and we have a lot of programs that we're going to be covering today. So this session will be recorded for your information. We will share the recording. I know Charlie from HPAC will upload it onto a YouTube channel, and we'll definitely share it out to those who aren't able to make it. So if you don't want to be shown in the recording, feel free to remain off camera and muted. And then there will be time for some Q&A throughout the presentation, okay? So if you have any questions, feel free to use the chat and we'll check it periodically. But I hope you enjoy the session. We have a lot of information, so feel free to stop us anytime if you have any questions. So my name is Esmeralda Trejo, and I'm the Assistant Director of Pipeline Programs. I'll have my colleague introduce herself.
Hi everyone, good afternoon. I'm Jacqueline Loya. I'm a program coordinator for the Health Coach program, and I also help with the FPL program as a community health instructor. So welcome and nice to see you all here.
So today we're going to kind of cover a little bit about understanding what the UCR School of Medicine's mission and values are. We're going to talk a little bit about the application process and requirements, which I'm sure you already know, since I know HPAC does a wonderful job supporting all of you UCR students. But then we're going to dive really closely into all of the programs that we're going to talk about today. So we have three. We have the Health Coach program, the Future Physician Leaders program, and the Health Sciences Partnership. So it's going to be a jam-packed day, so just letting you know, this will take probably the full hour and a half, but we still want to make sure that we cover all your questions regarding the School of Medicine. All right, Jackie, do you want to take this one?
Of course. So the mission of the UCR School of Medicine is really to help the people of California, specifically those in the inland southern region. So that includes San Bernardino, Riverside, and Imperial counties. And what we want to aim to do is train a diverse healthcare workforce that is going to come back and really treat the patients in this area with a lot of cultural humility and personal understanding around the social determinants of health affecting this region. So we want to do this through innovative research, through leadership, and serve as models to be emulated across California and the nation overall. We understand that this community is very medically underserved, and so we prioritize that in everything we do in terms of making sure we're addressing those health disparities to the best of our ability. So we look forward to all of you that are going to be applying and going through our pipeline programs, because we know that you're our future healthcare workforce, and we hope not only do you go off and become doctors, some of you might be nurses, pharmacists, public health professionals, other healthcare professionals in the field. So we look forward to all of the contributions you will make to this community.
Thank you, Jackie. So a little bit of that we look for in our application is, of course, the required courses, which I'm sure a lot of you are familiar. So this is just updated for this academic year. So just, depending where you are in your academic journey, just make sure you continue to look at our website, at our med school admissions, to give you a little bit more ideas about any requirements that may change. We have recommended courses. A lot of students sometimes always ask, do I need to take Spanish? Am I at a disadvantage if I don't take Spanish? What if you're a native Spanish speaker? So again, this is only recommended. The reason why we recommend Spanish is because we're looking at our communities. So like Jackie mentioned, we're really focusing on Riverside, San Bernardino area, and a lot of patients speak Spanish. So that's why we kind of recommend our future doctors to know at least some Spanish terminology. But again, if you don't take Spanish, that's perfectly fine. No need to worry. Another thing that we also look at in the application, not just, grades, we know that's important, but we also like to see you getting involved. So that's kind of how we play in hand with our pipeline program. So we like to see you have some professional development. Have you attended any conferences? Have you presented anywhere? Do you work? Do you work on campus, off campus? Do you have any leadership positions? Are you involved in any organizations? Are you, working with like HPAC, for example? I know they have their like peer mentors and peer students. There's also the CNAS advisors. So, you know, there's different ways to get involved with UCR and the UCR campus. So really looking and seeking out those opportunities. And they don't always have to be science related or med school related. So really enjoy what is it that you're passionate about. We do like to see clinical experience. So I did highlight here at UCR School of Medicine, for sure, we really like to see you getting involved with patient care interaction. So this is where a health coach might come, and Jackie will talk a little bit about that. And then community service. We really want you to get out into the community, really working with underserved patients, students, you know, especially from K to 12. You know, there's different ways of getting involved and really making a difference in this area. So with that in mind, we decided to, you know, develop these pipeline programs, and these different programs will give you these experiences that we're looking for as a med school applicant, or just any applicant in healthcare, right? So you want to make sure that this chart kind of gives you a big idea of what we offer. I don't want you to feel overwhelmed by all of these programs. We do a lot. But today specifically, I'm really going to focus on the Future Physician Leaders Program here, the Health Sciences Partnership, and the Health Coach Program right here. Okay, so just you know, feel free to check out our website to look at all our pipeline programs to kind of know a little bit more about how to get involved in each step of the way. So moving along, our first pipeline program is FPL, Future Physician Leaders Program. And so this is a summer program. So if you're in, you know, right now it's a good time to start looking at summer. You know, if you have any plans, we could definitely come to FPL. It is 9 weeks, and it was first started back in 2009 by Congressman Dr. RUHS. He, you know, was a physician, emergency medical physician in the Coachella Valley, and he saw, you know, the need that we need more physicians in the area. So he developed this program with just 10 students, and now it has grown to about 150, 170 students. So it definitely has made a large impact in the community the last 11 or so years. So definitely a program to get involved in, especially if you are somebody that, you know, doesn't come to UCR. We are open to any type of student. They don't have to only be UCR students. So just letting you know, just in case you know other folks that are looking for summer opportunities. Like I mentioned, we have now 2 sites. I know it started in Coachella Valley. Now we're opened in Riverside and San Bernardino. These are the dates. That way you're aware, you know, it is right after, you know, the end of spring quarter. And the application is open now, so you can definitely check that out. Our orientation is on May 18th, so just have that time and date set, just in case you are, you know, accepted into the program. You come to the program orientation, get to know a little bit about the expectations are, and you get to meet your team. We are giving preference to students who have some ties to Riverside, San Bernardino, and already being a UCR student, you are already at an advantage, which is great. And you have to be at least a junior in high school. So of course that applies to all of you here, but just in case you have any family members that are juniors in high school or any high school students that you think would be beneficial, this program would be beneficial for them, definitely let them know that we have the FPL program. And just so you're aware, we are entirely online this summer. We were online last year, and we will be continuing that this summer. We don't foresee doing any in-person interactions, but usually in the past, if it'd be in person, you would be driving to a specific locations, either in Riverside or Coachella. So when you're selecting the sites, even though we're online, please make sure to select the site that you are, your hometown is closest to. So even though, say you maybe live in Indio, but you come to UCR, please select the Coachella Valley site as your top choice. Okay, so based off of that, you know, we will definitely analyze and see how many spots we have reserved for each site. So just be aware of that. What does the program really entail? So we have 3 major components that everybody needs to be part of. So we have a community health project, and you'll be placed into groups and coming up with a health topic that you want to educate the residents of Riverside, San Bernardino, Coachella Valley. We have a lecture series. So we have weekly lectures where we invite different guest speakers to come and talk about their experience in healthcare. They're not always MDs, so we really like to get a diverse group of healthcare professionals. And we have the program Symposium. So in the health project, you will develop a poster and a written paper, and you'll actually present your poster at the program symposium to all of your family, friends, organizations that you partner with for your health project, and really show what you did those last 9 weeks. And then the mentorship program, which is optional, but it's open for students who are really for sure, they're like, I want to become a physician. And again, you don't actually have to do this program and have becoming a physician in mind. You could just be a healthcare worker. Maybe you want to go into public health, or you want to go into PA or nursing, for example. But the mentorship program is really geared towards those who are for sure want to go into becoming a physician. So this was actually started last year, and it was such a great hit that we decided to continue it. We actually paired a select number of students with a mentor, a UCR medical student, and we had weekly activities. So this is something that it is competitive, so just make sure that you do meet the minimum eligibility, which is at least 18 years old. But preference is given to students who are older in their trajectory, so maybe third year, fourth year students in college. And again, there is another additional documents that you have to submit on top of the online application, which I'll go over in a little bit. So the health project, I really want to make sure you all understand kind of like this is the basis of FPL. So you will be placed in a group of 5 to 7 students who will be coming up with a health education topic. You have to do your research on this topic. You have to connect with local resources, create an engaging presentation, a flyer, and a website. So this was very new last year. We moved on to technology that we really want to incorporate these elements into our program. So everyone was decided to, have them create a presentation, a flyer, and a website. And if you don't know how to do any of these things, we'll definitely teach you and provide you the tools and resources that you need. You will present your presentations at least 2 separate locations or more. We really want you to present them to as many places as possible because everything is done through Zoom. And we already know how difficult it can be to get participants in navigating technology. So make sure that you, are really available to be online and be able to do these presentations with your team. And then we also teach you how to do some data collection. So you are expected to conduct some surveys to your participants to learn, was your health education topic effective, and what did you gain from it, and what are some next steps, right? So like Jackie mentioned, she helps on this portion. She is a community health instructor and will help you throughout the way to make sure that your project is well delivered, and that way you're prepared for your program symposium to talk about your project. Here are some examples of some projects from this past summer. So again, you're open to creativity. If you're a creative person, or maybe you're like, I'm not creative at all, definitely you will learn how to work together with your group and develop these skills. And think about it this way, if you're going to become a physician, you're going to learn how to communicate to your patients about any illnesses and diseases, right? You want to make sure that you're creating material or information that is relevant to them and that they can understand your presentation. So definitely a great way to just, develop those skills or enhance them if you already have them. Lecture series, like I mentioned, we have different guest speakers. They are from all over, healthcare professionals. We've had researchers, we've had PAs, nurse practitioners. So we really just invite anybody who, wants to serve, has been serving students or patients here in Riverside, San Bernardino County. And they come and share a little bit about their story. So sometimes you would be surprised. A lot of them are non-traditional students, which is nice to hear kind of different paths getting into the medical field. And then you are expected to write some journal reflections to go over what have you learned from these guest speakers. So just be aware that it is like a class. This is a perfect time to network with others. It's perfect time to, maybe learn, maybe they offer some volunteer research experience that you can possibly get part of in the next academic year. So these are really great speakers to connect with. And we also have a program symposium. You will be presenting your project in a poster style, so I showed it there. And more details to come as we get closer to August, but this usually is the concluding program. And the mentorship program, like I mentioned, this is new. You have to be at least 18 years old, and you have to submit one letter of recommendation. It can be from an advisor, a community member, your employer, anybody that can talk highly about you. It does not have to be a faculty member, but it helps, but it does not have to be. So just anybody who can really talk about you and who you are as an individual and why you want to be part of a mentorship program. The letter of recommendation is online. So we'll kind of talk a little bit about that, but they do submit an online form and can upload their letter all online, which is on the website. The commitment, again, so like the Community Health Project is about a 15 to 20 hour commitment to be part of FPL in general. That includes going to lectures and actually dedicating time to creating your materials. But the mentorship program is an additional part that does require about 2 to 3 hours a week, because you do have to make sure you meet with your mentor at least 1 hour once a week, go over the activity that was scheduled, and then you do have some reflections and journals there. So just have an idea if you are planning to do other activities, like if you're planning on working or volunteering on top of FPL, just make sure that your schedule is fairly flexible if you are accepted to the mentorship program, because you want to really be available for your mentor who is a current medical student, and they might be having clinical rotations and so forth. So just be aware of that. And then the application and commitment, here I just gave you just brief overview. We do have a program calendar on our website, so please check it out. But here's when the lectures are, that way you're aware if you're planning to do other activities. And then the program symposium is expected to be sometime between August 10th and 12th in the evening time. So just be aware you are welcome to do other things outside of FPL, but we want to make sure that you're not overcommitting yourself and you're really putting as much as you can into the program. And like I mentioned, the application is now available on our website, and it does actually require, there's 5 short essays that you'll have to write. No transcripts or letters of recommendation needed if you want to just apply for the regular FPL program with no mentorship. But if you want to do mentorship, you do have to submit those additional requirements on top of the online application. So what are the benefits? You definitely get to learn what are health disparities and inequities happening here in Riverside, San Bernardino County. This allows you to become a better physician, a better healthcare provider when you're working with your patients. You do a lot of public health research, as I mentioned, the Community Health Project, and we definitely guide you on how to do that. And I know it might seem, why I want to become a physician, why is this important to me? And we really like to bring those connections and really understanding who your patients are and how you can provide the best care when you become a physician. We definitely cover public speaking, communication, marketing skills. All these skills are definitely important, especially if you're going to go through interviews, job searching, internships, anything, marketing, especially we're in technology mode right now, so really developing those skills. And you can talk about your project that you did in FPL and put it on your resume and really show others and showcase what you've done this past 9 weeks. And of course, networking, meeting different healthcare professionals and individuals that you can possibly continue your relationship past the 9 weeks, and hopefully, getting some research experience in the academic year. So here are some deadlines, just a quick snippet. The application is April 7th. That's the deadline for the mentorship program and the regular priority application. Just so you're aware, the Riverside San Bernardino location is the more competitive location. So I would highly suggest try to submit by the April 7th deadline, regardless if you do mentorship or not. And then April 28th is the final deadline for all locations. Then you will receive acceptances around May 7th, and then May 18th is a program orientation, and that's the first orientation, and we start the program on June 14th. And if you have an Instagram, follow us on Instagram. We do post a lot of important information. You don't have to be part of PL to follow it, but feel free to do so. We will be having other informational sessions that we'll post on there as well. So here's my contact information if you need anything, and then please visit our website to get the application online. At this time, I'm going to ask, we do have 2 student speakers who did FPL in the past, so I'll ask them to kind of share a little bit about their experience. Nisha, did you want to go first?
Hi, my name is Nisha Cambo. I go to UCR and I participated in FPL in summer of 2019 at the Riverside San Bernardino site. This was right before the pandemic started, so my group members were able to meet each other in person. This was before like life was different. Uh, for our CHP project, we raised awareness regarding strokes. We wanted to go out into the community and disseminate this information to the Latinx community of Corona. We chose this topic because it was really prevalent in the community, and if you take care of your body, the chances of surviving a stroke and preventing a stroke is really, really good. I just wanted to say that FPL is a great opportunity to really grow and expand your skills, whether it be public speaking, learning proper communication, or even time management. This program is like being a part of a part-time job, so it does require a lot of time. So it's really important to start communicating with your group right away. This past summer, I was given the privilege to be a group facilitator. So I was in charge of 2 groups. And the common theme that I noticed was that the groups that were communicating and dividing the work, they were really benefiting from the program. And the groups that weren't, they had a hard time keeping up. So my biggest tip for you guys is that when you put in the work into this program, you'll get so much out of it, whether it be the professional development through the leadership lecture series or just expanding your presentation skills. So trust me, if you put in the work, you'll do amazing. So I highly, highly recommend applying by this priority deadline.
Thanks, Nisha. I had a question in the chat asking about if you applied to the program with mentorship, is it possible for you to be denied mentorship but be able to get into the program? Yes, that is correct. So the mentorship is a little bit more selective. So I do review, applicants for the mentorship, and then I do review applicants without the mentorship. So if you are accepted into if you're not accepted into the mentorship and into FPL, that's great. Don't feel discouraged. You can try again another time. You can definitely do this program multiple times. And so we really look at different factors, what year you're in college, your letter of recommendation. That's why I say make sure you pick a person who's going to write highly about you. And then your essay. That's just the main tip that I can give you, is really make sure you work on those essays and making sure you really talk about your passion and what is it that you're interested in, why you want to be part of these programs. So I'm moving on to Amanda. She actually did the mentorship program, so maybe she can share a little bit about what they did and what she learned from there. So Amanda, if you want to introduce yourself.
Yeah. Hi, everyone. My name is Amanda. I graduated from UCR, and I was actually part of FPL this past summer when it was solely online. FPL is an amazing program. I learned a lot about my community and the health disparities and how to better educate my community. And everything that we learned from our leadership lecture series, we applied it to our community health project. And my group and I decided to focus on autism, specifically nutrition, and how parents and caregivers can provide individuals with autism a more nutritional diet. It was a lot of work. We met almost every other day online via Zoom, which was convenient. And I was also part of the mentorship program, so I had a lot of time committed towards FPL. And it's a lot of work, but it was totally worth it. My group and I actually presented at the School of Medicine conference this past weekend. And so all our hard work really did pay off. And just to talk about a little bit about the mentorship program, I was matched with, at the time she just finished her first year medical school, and we kind of went through the process of how to apply into medical school. I'm in the process of my gap year, so what I can do better, and especially about preparing for interviews and like writing personal statements. So it was really beneficial. Would definitely recommend applying if you have the time.
Yes, thank you, Amanda. Do you by any chance keep in touch with your mentor?
Yeah, I actually texted her yesterday. We were in touch. She's actually reading my personal statement as we speak. So yeah.
Good. Yes, awesome. I'm glad to hear that, because this was a pilot program, and actually it did, we got some wonderful reviews that we decided to keep it. So if you are familiar with the FPL program, maybe you've heard about it before. We used to have shadowing, so we no longer offer shadowing, and we're moving towards this mentorship program. And I think it'll be beneficial for our students to really get a mentor and helping them, guide them through this application process, because you're going to be there pretty soon, right? And so they've just completed it, so they can give you more of their personal experience. So thank you for sharing. So at this time, I'm going to move it more towards health coach program. So I'll have Jackie take it away.
Hi, everyone. So that's always a very hard act to follow. FPL is a wonderful summer program. So I thank you for tuning in, and I hope that you can also see how what you learned through the FPL program can also transcend into the health coach program if it is you plan to apply. So what is the health coach program? It's a collaborative partnership with Riverside University Health System, which is our county of Riverside's hospital and healthcare health system. So when you apply to the health coach program, you're actually going to be volunteering within the Riverside University Health System. On the UCR School of Medicine side, what we do is we help support your professional and academic growth as well throughout your process. But it's really the county health system where you'll be going through in terms of trainings on motivational interviewing and how it is you can truly address patient care. So you have two people there on the screen other than a picture of some of our old health coaches, and that's Dr. Jeffrey Leung and Dr. Neil Sheeler. I just like to highlight them because thanks to them, we've had this program since 2013, and it was really a vision of both of theirs. One from Dr. Leung acknowledging that we just don't have enough time. Our providers don't get enough time with the patient. Usually when we see a doctor, it's only about a 15 to 20-minute visit. And he understood that there was a lot of primary care patients that just had some health literacy issues or needed some more guidance and motivation in between their visits with their doctor to work on lifestyle management goals. So he learned about a health coach program out in UC San Francisco and managed to bring that model to our area. He reached out to Dr. Neil Schiller at the time, who was overseeing our student affairs department as well as our pipeline programs. And he said, I know there's a lot of people, young professionals, that want to gain more clinical experience before they actually go into graduate school and into the healthcare field. How about we partner? I learned about this great model and allow that volunteer experience to happen. So that's how the health coach program, came about, and it was really a vision of both of these individuals. So, program description. What does the program entail? We're looking for third or fourth year undergraduates or recent graduates. So if you're currently a second year or community college transfer, then this program would still apply to you. If this fall, I should say, fall of 2021, you will be in third year standing. I know all of you here, to my knowledge, should be UCR undergraduates. So if you will be in third year fall standing this fall of 2021, then you can definitely apply. Or if you're a fourth year, or if you will be graduating. So please consider if that is you. The program dates, our program runs from September of June of every year. So this year that's September 1st of 2021 through June 30th of next year. We do host a program orientation that includes orientation for you to get familiar with not only the UCR School of Medicine staff, which is myself, but also the Riverside University Health System staff, because there's a program director on that side, as well as some supportive staff that help manage the clinical workflow and protocols of the health coach program. So that is going to occur during the last week of May of this year. And then you do have to do some onboarding between June and August. So because you're working with patients, you do have to pass a background check. So for those of you that have a Social Security or have DACA standing, you definitely still qualify and are eligible to apply. And we also have you go through a series of volunteer onboarding trainings through the health system. So that's why it's important to just be mindful that between June through August, there might be some onboarding. And once you get accepted into the program, those dates become a little more clear as they are finalized with our health system. So also just to give you a general overview of what our health coaches look like. So not for this current cohort, but for last year's cohort, we had 30 to 35 health coaches, and that is every year. Some of those coaches are continuing coaches. Some of those coaches are new coaches. So it just depends on the clinic need and if our current coaches will be leaving us and continuing on to greater things or want to stay for another year. But in general, we accept about 30 new health coaches every year. And then we have a total of 15 clinics that we can place a health coach into. You do not rotate through all of those clinics. You are placed with one clinic. You might do some training at another clinic when you start your initial onboarding, because although this is COVID and we're in COVID times, we have changed our model of the program to a hybrid model. So most of our coaches are remote right now, but when they started, they still had to come into clinic, and you're required to use protective equipment, so masks, and practice social distancing to make sure that not only are you staying safe, but so are your patients. And then once that onboarding and training process is over, then you're encouraged to be in the clinic if you like, and if you don't, because we want you to prioritize your safety first, then you can have that option of being remote. And then in general, we serve over 1,000 patients every year, and that's collectively for our health coach team. And they also put in over 6,000 hours every year just managing direct patient care. So as you can see, they are amazing. They contribute a lot of time. It takes a lot of commitment and dedication and just passion for patient care. Next slide, Esmeralda, please. So a little bit more about expectations. We do require you 260 volunteer hours. Again, that's within an academic year, and we go based off the UCR calendar, so between September and June. What does that look like? Typically, most of our health coaches either do a full 8-hour shift, so they'll block out a day within their Monday through Friday calendar, or they'll do 2 half-hour shifts. There are some clinics that offer occasional weekend hours, but all of those clinics, regardless if they have some weekend hours or not, require you to do your volunteer hours within their clinical operation hours. And for instance, if a clinic is to close at 5 p.m. For a day, sometimes they require you to see your last patient like with 30 minutes before the clinic ends, just to ensure that not only your safety and the safety of the patient is met, but that they're meeting their clinical operation hours. So please make sure you visit the website and visit the link regarding our location hours and locations for our clinics when you apply, because there is an option for within the application where you can rank your preferred clinic, and we're going to go based on zip code as well in terms of convenience to getting to the clinic, and we'll do our best to match you with your preferred site. I can't guarantee that you'll be matched at your preferred site, but we will do our best to do that. Please also note up to 40 of your volunteer hours can be used to support outreach events to recruit the next cohort of health coaches. So for instance, today we have 2 wonderful health coaches that are going to be helping with just sharing their personal anecdotes and experiences with the program. So they're going to log in this time as well as part of volunteer hours. We value your time, and we know that this is volunteer, and you're doing this not only to gain more experience, but also to help us get the word out on the program. So what do we look at in your application and when we're reviewing applicants? We're looking at 3 different things, as well as time management, but these are the 3 top things we want all of our health coaches to have, and that's professionalism, teamwork, and great communication skills. So in terms of professionalism, you're going to be asked to complete trainings, some paperwork, a lot of onboarding material when you first start off. And it's very, very important that you complete that in a professional manner, but also in a timely manner. So if you know ahead of time that you might have some delays in getting something done, please make sure you reach out to the program staff immediately so that they can accommodate you and also work with you around setting a deadline that maybe is more flexible and convenient for both of you. We also expect you to be on time for all events or meetings that we might have. That includes our trainings, and that you follow established protocols and procedures. So again, I remind you, you're volunteering for a healthcare system, and I don't think it's stressed enough or emphasized enough how much that health system is allowing you to access their information. Although you're volunteers, you're basically treated like another employee, and you get access to very sensitive patient health information that other volunteer programs just don't allow you access to. So it's a very unique program, and we're very lucky that our county partners allow us to have you in the clinic system. So that's why it's so much more important that we just carry ourselves with the ultimate professionalism. And then in terms of teamwork, you will be working collaboratively with a healthcare team. So that includes doctors, nurses, dietitians, pharmacists, etc. Anyone that could be in the healthcare setting, along with our clerical staff. So our staff that are like scheduling appointments and greeting patients, they are also very key to your team. So it's very important you're communicating with all parties and partners within the team. You also get to act as a liaison and advocate for your patients. So when we're looking at applications, we're going to ask you about your teamwork skills. So make sure you can emphasize, how well you work with others. In terms of communication, you'll learn to use a skill called motivational interviewing, where basically you help guide patients through making lifestyle management goals. So no one likes to be told what to do, right? I myself included, when I go to the doctor, I don't like for the doctor to tell me that I need to take something out of my diet or maybe exercise more. I like to come to those decisions on my own and have my own autonomy. So you learn this really great valuable skills that you'd be surprised some providers don't have training in even now, or just starting to get more training around this. And it's a skill where you help guide patients into coming up with their own solutions to their healthcare problems. So it's a wonderful, wonderful skill to have. And you will also have to communicate not only changes in your schedules, but also if, for example, there's a patient that maybe was referred to you, but it's not the most appropriate referral because maybe they have some behavioral health issues that need to be better addressed with a psychiatrist or a behavioral therapist, then you need to be able to communicate that back to your healthcare team as well and ask for that patient to be referred elsewhere before you can even meet with them. So again, very important skills to have, and these are all questions that our short answer essays are going to try to get at when we're reviewing your application. So what are some benefits to the program? As I mentioned before, on the UCR School of Medicine side, we're really here to help you with your professional development growth. So as part of going through the program, you will be invited to our professional development series. And if you are part of another pipeline program, it's that same series that you would be invited to. Through this series, you learn things like how to set up a personal statement for the medical school application process, which I know HPAC supports as well, but some of our students are not UCR students, so this welcomes even individuals outside of the UCR system. And then there's also networking opportunities, so we encourage you to network with each other as well as with other healthcare professionals. Just last week, we had a session where we invited some of our current medical students, and they just participated in an activity with our health coaches and are making themselves available now as well, so that if our health coaches have questions, they can reach out to them and set up one-on-one meetings with them. We also encourage you to work on your wellness, because so often our healthcare professionals give so much to others and don't do enough for themselves. So if we're not healthy and we're not well, we tend to not act to our fullest ability. So I myself make myself available for one-on-one professional development and wellness coaching. So during these meetings, I talk to health coaches anywhere around planning their medical school application process. So we'll set a timeline and goals, and I keep them accountable around that. To their wellness. So sometimes we're working on wellness goals. Maybe someone wants to learn more about mindfulness and meditation and how that can benefit their well-being, or they just simply want to gain a little bit more control around their schedule. So I help them with creating a schedule and a plan that's going to help them allow them to do that and include wellness into their everyday routine. And then in terms of the meat of the program, what you learn through your experience in the clinical setting, like I said before, motivational interviewing, how to set goals with patients and guide them through them. You also learn how to work through an electronic health record system and how to document based on county protocols and workflows, which is so important. A lot of our providers are still trying to balance patient care and charting in a electronic health record system, so you'll be ahead of the game when you go through the health coach program. And then there's also some wonderful special projects that our team at Riverside University Health System is leading through our population health initiatives. So nowadays, especially since the Health and Human Services Department in the U.S. acknowledged that all of our healthcare systems should be addressing social determinants of health and not just the illness and disease. All of our healthcare systems around the country are trying to better understand and create procedures to do that. So for example, the county has set up an assessment called the Whole Person Healthcare Assessment, which basically acts as a survey that asks individuals a series of questions to try to better address what else is going on in their lives that might be impeding their full wellness potential. So that can include something like food security. Do they have access to healthy foods? Why or why not? It can also include things around transportation. Does this individual have access to reliable transportation? Why or why not? And what can the health system do to better address that? So it's a wonderful health system to work in because I really feel like they are guiding and leading a lot of that work. And they've been doing this for not just the last year, for many years now. So it's very exciting stuff to be a part of and to contribute to in patient care. Next slide. So who can apply? I know I've reviewed this a little bit already. So again, as long as in the fall of 2021, you'll be a third year, a fourth year, or a recent graduate. If you have strong ties to Riverside and San Bernardino County, that's very important too. I did get a question in the chat around, do I have to be located in Southern California in order to apply for the program? So again, because you do have to do some in-person training, you will be asked to be within the Riverside and San Bernardino County when you apply and when you're going through the program. So between September and June, you definitely have to be in this area because at any point in time, you may be asked to come into the clinic. And we also want individuals that have a strong commitment to serving this region. So even if you didn't grow up in this region, but you have family here or you are attending school here because you're attending UCR, then we consider you for the program as well. And then those that have educational or social economic disadvantages are also encouraged to let us know a little bit more about how that's affected their career journey, especially within healthcare. I always get the question around, what if I have a science GPA that is quite not at the 3.0? I know that's something that is required when you apply. So we have made some exceptions for those individuals if they can really tell us and have their passion shine through in the application. So what I can encourage you to do is, one, make sure that you're answering those questions very clearly and also allowing yourself to be vulnerable when you're answering those questions. And what I mean by that is, letting me know what else around your reasoning and motivation to be a healthcare provider is embellishing your passion for the field. So if you have any questions around that, you're more than welcome to email me directly and we can talk about that a little more on a one-on-one. You can find the application on our website, hcp.ucr.edu. It's completely online application. In the past, you had to do the online application and then email your unofficial transcripts and resume separately, but this time around, you'll be able to submit that all in one area. The only ask is that when you submit your unofficial transcripts, that you put them into one document. So ways some people do that is by taking a screenshot of every college undergraduate transcript they have, and then putting it in a Word document and saving it as a PDF, and then uploading it into the system. So that's my tip for you around that. When it comes to the letter of rec, like FPL, that doesn't have to be a professor, as long as the individual can attest to your professionalism, teamwork, and communication skills. So they can't be family members and they can't be a fellow colleague, like a classmate, but they can be undergraduate faculty, a pre-health advisor, a mentor, an employer, etc. So those are people that we're looking at for applying. And there's also a link under our website. If you go to, I think it's like supplementary documents, or can't remember the exact term, but I think it's required documents, sorry. So if you go to the required document section on the very bottom under the letter of recommendation guidelines, there's a link there that you can share with your recommender. So next slide. And our application opened up yesterday. So it's been live as of noon yesterday. We do have a priority deadline of March 17th. So we do prioritize those that have met the priority deadline. There's a final deadline of April 28th. We do conduct interviews for final candidates the week of May 10th, and that the exact dates and times are just going to depend on our final candidate pool. So more to come on that, but if you are a final candidate, we'll let you know ahead of time of those dates and times. And then the program orientation will take place the week of May 24th this year. The interview is in the multiple mini interview format, which means that it's a similar format to applying to medical school, where you will be basically interviewing with different people in different rooms. We're most likely going to conduct that online this time, so we'll use the breakout rooms to do that. You'll get 2 minutes to review a question and then 6 minutes to answer the question live with the individual. And you will get briefed before your interview, so you'll have some time with me to practice a little bit around how that looks like. There's my email there on the screen, and there's a link to our application there. And I also have 2 current health coaches with me today, so I wanted to allow time for them to just share about their personal experience with the program. And then at the very end, if we have time for Q&A after Esmeralda goes through one of our other programs, then you're more than welcome to continue asking your questions then. So first, I'd like to invite Joanna to introduce herself and share a little bit more about her experience in the program. And if you have any tips around the application process, please feel free to share as well, Joanna.
Yeah, hi, everyone. Thanks for joining us. My name's Joanna Godoy. I'm actually a post-bac RCC student. And just a little bit about where I am. I'm a health coach for Paris and Paris Valley Clinic. So here in these clinics, the majority of the patients are Spanish speaking. So if you do speak Spanish, I think that's a wonderful plus for our community here in the Paris area. I feel like if you don't speak Spanish, there's also trainings on how to use the translator system and how to communicate with patients. Just a little bit more, my patients tend to be middle-aged, mostly female, and I think there's other research why that is, but I think overall, things that I've learned here that I find very unique, it is the motivational interviewing, as Jacqueline mentioned. I think that's a skill that's going to help along, in your future career. I know individuals who are physicians who are still trying to, as Jacqueline mentioned, trying to learn this skill. So I think that's really a huge benefit to us. And if you like reading, there's also a lot of evidence-based research on health coaching and how valuable health coaches are to health systems. So I feel really grateful for being a health coach and being part of that. Another thing is documentation. You actually learned a little bit of everything. So you're meeting with your patients and you're, you know, documenting at the same time. So you're kind of getting that real feel of being a provider in a real setting. What else? For myself, we do have the option of working virtually or in person. For myself, I chose to be in person just because I preferred to come to clinic. I like the feeling of coming to clinic, but my appointments with patients are half and half. So I have a combination of in-person visits and over the phone visits as well. And just overall, I think the program, the leadership program does a great job to developing us and just developing the program to make sure that we excel in our future careers. So there's a lot of support from our program leadership. I think that's all. If you have any like specific questions, I'll be happy to answer them.
Thank you, Joanna. And up next, I'd like to invite Wajiha to share her story and her experience with the Health Coach Program. Wajiha, are you?
Apologies, I was muted.
Oh, okay, there you go.
Everyone, my name is Wajiha. I've graduated from UCR. I'm currently in my post-bac year. And I'm also, this is my first year being a part of the Health Coach Program. And just like Joanna said, I think I cannot emphasize enough what a resource and an insight it's been being a part of the program as far as interacting with a network and a team and getting that understanding of how healthcare works from the standpoint of a provider. So I know Joanna hit a lot of these on the spot, but for my own personal experience, I'm currently in the Family Care Clinic, which is a clinic located inside the main hospital at RUHS. And although in the beginning we were going in clinic, my clinic has been converted to a COVID unit. So a majority of my patients are now through phone visits, and that's how I am interacting with them. But with that being said, I think one of the most important things that I have learned, or a skill that I've picked up, is beyond dictating and being familiar with the electronic medical record. I found that, I believe this year, at least for my being able to work with patients and understanding the, like mentioned before, the social determinants of health that can affect a patient, especially during a pandemic, has been so vital in understanding how patients interact and how individuals interact and how that interact with the different aspects of their health, whether it's transportation, whether it's finances, mental health, which has played a big role during COVID, and how that affects their overall health care. So I found that to be a very insightful experience in trying to talk to my patients and kind of understand where they're coming from and help them, guide them on this journey, right? Coaching them to make sure that they're reaching the goals that they aspire to reach. One of the cool things that I like about working in Family Care Clinic is I get to work with some of the providers that have been there for many years, very experienced, and I can touch base. So that includes physician assistants, that includes nurse practitioners, that includes nurses, and of course that includes physicians. So a great network that you have as far as networking and resources and advice for if you're interested in going into healthcare. I suppose one of the most helpful things or tips I can give for while you're working through the application, if you're interested, is take a look at the application early on to try to get an idea of what type of questions are asked as far as the short answers, so you can kind of rough draft or plan out how you're going to answer these questions. And like Jackie said, how can you showcase that you're working as a team member? How can you showcase the leadership skills that you have? Those sort of things I think will be good for you to kind of brainstorm early on instead of rushing it. Because if you rush something, I feel like it's going to show, and you want to give your best foot forward when you're applying to this program. I think that's all I have on my end. If any of y'all have any questions, feel free to reach out to Jackie, and she has my contact information otherwise. But I really hope that y'all take advantage of this opportunity and apply, because it is by far, as far as patient experience and clinical experience goes, this has been one of those programs that has allowed me to get the most interactive and not invasive, but meaningful hands-on experience with patients.
Thank you, Ajika and Joanna, for sharing your anecdotes and your stories. I really appreciate you both. So I believe Esmeralda is going to continue to our presentation today to talk about another wonderful program, which is our Health Science Partnership Program.
Thank you. Thank you for sharing. So last program, I know it's already been almost an hour, but this one is one of actually our oldest programs that actually started back in 2001, if you can believe that. So it is one of our longest standing partnerships. It took a little break a few years before I started here. And so, you know, when I started here at the School of Medicine back in 2019, this was one of my projects, is kind of revitalize HSP. So this is a little bit different from the last two programs that we talked about. I really am just looking for undergraduate students who are interested in mentoring high school students. So if you're interested in just giving back to the Riverside and San Bernardino communities and going back into the high schools and really, you know, tell them a little bit about yourself. How did you navigate higher education? Why did you want to go into pre-health? Why do you want to become, you know, why did you decide on this major? How did you navigate finances? All of those things. If that's something that you want to do, Health Sciences Partnership is definitely a program for you. So it is for students who are at least going into their second year. So if you're a freshman right now, you're welcome to apply, as long as you'll be continuing, you'll become a sophomore standing by fall 2021. And a lot of the classroom visits right now are on Zoom, of course. But we do hope that we can get back to in person, and you would be going out to the high schools and providing these presentations. So we always have about 15 to 18 mentors. You know, I place you into groups and you get to rank, you know, which high school site you would like to be part of. So this is kind of like the snapshot of what we currently have partnered with. This may change. I'm looking to have additional high schools to be onboarded, hopefully in the fall, but just as right now, these are our current partners. And again, like I said, we do hope to continue online as needed, but if you are expected to go back in person, if we are allowed to, you are expected to go to the high schools, and so making sure you have reliable transportation. So the program components, we definitely do have training for you. We will tell you a little bit about what we're looking for in these presentations, like we mentioned, making sure that they're engaging, making sure that you are planning thoughtful activities for these high school students. Remember, these are high school students, so if you can remember back to when you were in high school, making sure that you get them excited for higher education and pre-health majors. We also want to enforce that it is a time commitment, even though, you know, you're not, you know, physically going to be going to the high schools maybe every week, but you does take time to create these presentations, working with the team. Then you have to drive yourself to the high schools, present to these students, and then drive back, right? So you want to make sure that you put in enough time commitment. This is approximately, again, these hours. I do have students that will share their experience, but just, you know, be aware of what else you are involved in the academic year. And then I just gave some examples of some topics, but I definitely leave it up to the mentors to think about topics that maybe they wish they would have known. I do guide you throughout, but really think about, you know, what is it that you wish you would have known when you were in high school? And now that you're in college, what advice can you give them? And of course, the students will also give you some topics too that they want to know about. Program benefits, again, public speaking, communication, presentations. So I know this is a little bit different because it's not really too much healthcare related, but it's really a time for you to really hone in on those skills and how to talk to different audience groups, especially high schoolers. You know, you do have to learn new techniques, new ideas, and be innovative and get them excited for education. We do, you know, you are a mentor. They look up to you. You're a college student. So you are really, you know, taking on that role of what else can I do to really help these students become the best, you know, students and ready for college, and making sure that they're prepared. Professional development, like Jackie mentioned, we do offer various professional development workshops, monthly workshops for our pipeline students, so you would be invited to those as well. And I do also have quarterly meetings with the HSP mentors to really talk about, you know, what's going on at their schools, pros and cons, advice, because every school is different and every group, you know, has different challenges and different techniques that they can share with others. So these are just kind of some ideas that we've been doing this academic year. But we're always welcome to, for our pipeline students, to suggest any other ideas that you'd be interested in seeing. So here's kind of the snapshot again about HSP. If you are interested, the application is now live on our website as well. Please visit hsp.ucr.edu. It is on the website. You don't have to submit a letter of recommendation, nothing like that, just an online application. My advice to you is make sure you read those essay prompts. It's just 2 essays if you're a newcomer. If you're a returning HSP mentor, they reapply as well, and they have to write an essay too. And just make sure you answer the prompt, and make sure you're very specific and concrete, and understanding who your audience is and answering the question. Deadline is April 7th as well, similar to the FPL deadline, priority deadline. So just know you have about 2 months to write it. It's not too long, so you can definitely check it out. And I will have the students share, about their experience. So I had Radhika, if you want to talk a little about yourself and HSP.
Yeah, so I'm a HSP mentor, and I just joined in June. So I was accepted. And now I'm a sophomore, and I'm a student at UCR, of course. So I applied to HSP because I really wanted to form connections with individuals in our Riverside community. I wanted to know more about the individuals living in the IE and how I could help them, especially younger individuals, and maybe help them to find the passion, and also to have the resources to pursue these higher levels of education, or even just to help them out in their daily lives. So being a mentor, I learned that a lot of students don't think that school is an option for them, especially we do mentor a lot of disadvantaged students who come from households that may not have the money to send them to school, or they may not have parents who have had higher education. So they may not think that school is an option for them, but it's our job to give them the resources and tell them about scholarships, to tell them about different ways that you can obtain financial aid, and also to tell them about different programs that various schools can offer, and how state schools can vary from the UC system. So a lot of these really crucial things, pieces of information that we can tell these students will really help them in their personal development. And beyond those types of presentations, we also give presentations for studying tips, for stress relief, extracurriculars in college and in high school, different types of health careers, so that we can motivate them to pursue these goals, and also to just give them more information on topics that they may be interested in. And we do provide them with a form after every class we teach, so that they can tell us what they liked about the presentations, what they didn't like, so that we can revise and then get back to them, and hopefully give them more presentations and provide them content in a way that they'll be interested in. And I've only mentored in the online environment, but even in this online environment, it has been extremely rewarding, and I would highly recommend that you definitely apply to this program if you're interested in teaching, or if you're interested in your own personal development, because really trying to shape content in an interesting way for these high school students in a way that they'll be able to understand it is a really valuable skill. And on top of that, trying to answer their questions on the spot when they want you to give them information about schools, or about or just advice on how they should approach issues in their life. So I just think it's overall a really good program. And as Esmeralda was saying, there are the hourly commitments can vary, and it depends, really depends on if you're presenting 1 week or not, but developing the presentations do take time, and then also presenting it. If you do present, you may present to 5 classes in a week, or maybe 4 classes. So it really depends. And yeah, I just highly recommend it. And thank you for listening.
Thanks, Radhika. Yeah, so like she mentioned, the students actually right now, because we are on Zoom, and we've been here for a while, the teachers have actually told me that they have been really impressed with the mentors, and they love their presentations. Again, we might be a little too much on the presentations, but they actually say that they love their presentations. The students actually get excited to see the mentors because it's something different, and just to, see a college student to come and talk to them about college, and they're also, stuck out at home too. And so sharing their struggles as well. So I also invite Gabby. Do you want to share a little bit about HSP yourself? And she's actually a returning mentor from last year.
Yeah, of course. Thank you so much, Esmeralda, for having me talk today. So yeah, as Esmeralda was saying, to introduce myself, I'm currently a third year at UCR. It is my second year being an HSP. Last year I was in the Riverside group, so I was, with their high schools, and this year I'm with the San Bernardino group. And I think what's really like the best thing about HSP, in my opinion, is, first of all, I love being a mentor because I love interacting with the high school students. And, I was fortunate enough last year to be able to actually go to the high schools and interact with the students, personally, face to face. And, it's really interesting, the things we take for granted nowadays, like knowing about FAFSA, knowing how to study, knowing how to set up a resume, knowing even how our schedules are as college students, just things we already take for granted. Our high schoolers probably don't know too much about them. And, from my experience, they don't know pretty much a lot about any of these things. So I think just really getting to interact with the students in that way, getting not only to like teach them, but just, mentor them. And of course it is a mentor position, but really interacting with them and, helping them, guide them through, as, Radhika was saying, getting to college or getting to a secondary, post-secondary university system, which, it might be different for everyone, but letting them know that they have the options and they have the resources to do that. I think another really underrated part of the HSP program is, learning about how to make presentations, how to public speak, and also the professional development series as well, because those are things we also, as college students, we take for granted too, is how do you make a good presentation? How do you make sure that, if you have a good presentation and you have a good PowerPoint slides, how do you make sure that the students are paying attention to you and not just how pretty your slides look, things like that, we don't usually get a lot of practice as college students, has really been helpful with the HSP program for my personal development as well. So, not only do you get to help mentor these high school students, you get a lot personally for your professional development and of course, career development as well, which I really appreciate.
Thank you, Gabby. It's been great having you again for a second time. So I'm leaving the last slide for questions. Thank you for attending. We'll open it up to any questions either for ourselves or for the students, let's say mentors, also mentors. Any questions? And I left our websites there, so all the applications are online and they're all open.
You can also type your questions into the chat if you're shy and don't want to mute yourself. But we also encourage dialogue, so whatever you prefer.
Hi, my name is Nuja. I just have a quick question about the health coach program. Great presentation overall. Thank you guys. For the health coach program, do the coaches work with multiple patients of different physicians, or are they just assigned to one physician at a clinic?
That's a great question, Anusha. So I'll allow our health coaches to elaborate a little bit more, but just in general, they do get patients from different providers. But Joanna or Wajika, you want to take a stab to explain a little bit more of what that might look like?
Sure. So I think this will depend clinic by clinic. So for my clinic, for example, I see patients from 3 particular providers just because they're comfortable with allowing us to see it. But I think each clinic has a different dynamic on who's comfortable with you seeing their patients or reaching out. So I think for the most part, though, providers are welcoming and they're encouraging of us interacting with their patients, granted that the patients meet the certain criteria that we have. And, you'll learn more about this if you're into the program, but certain criteria for health coaching. And Joanna can elaborate if she has something different at her clinic site.
Yeah, so similarly, so both the clinics that I go to, they're family medicine. So we work with either a family medicine physician or nurse practitioners. So I actually have 4 different providers that I get referrals from or that we have mutual patients. I believe there's also a pediatric site, maybe Jacqueline, but for the majority, it's all family medicine. And we also work close with the nutritionist, the dietitian. So sometimes they have patients that we can help, like they give them the more like nutrition information more in detail, and then the health coaches can help support that or help the patient continue a goal with what they learned from the dietitian. So there's also the dietitian, and there's other like home health programs, other programs that it's really like networking. You kind of have to get out of your zone to like network with them so that they could refer you patients, you refer them patient, and it's actually like the network experience and just really becoming that whole healthcare team for your patients. So yeah.
Great, thank you.
No problem. Any other questions? That was a great question.
Thank you, Charlie. Just a reminder, the recording will be posted on the HPAC YouTube channel. So thank you, HPAC, for hosting us today. We appreciate it. And just a reminder for eligibility, remember FPL and health coach, you do not have to be a UCR student, so feel free to share this information with others. And for HSP, you do have to be a UCR student. So please share within your networks if they're interested in becoming an HSP mentor.
I'm also seeing another question in the chat. It's saying, for all these amazing programs, is it specifically geared towards pre-medical students? So no, as Esmeralda mentioned in the beginning when she was reviewing FPL, so you don't necessarily have to want to be a doctor to apply if you're just interested in pre-health in general, or maybe public health, or you want to dive your toes into that area first. FPL is certainly one of those great ones. Usually people that apply to health coaching, they know they want to go into healthcare. They just want to gain a little bit more clinical experience to either solidify that passion or maybe decide that's not for them. So I do look for people that can tell me that this is what they really have an interest in and a passion for, but they need to solidify those skills and thoughts and decisions. So I hope that answered that question as well. And I think for HSP, Esmeralda, I don't know if you want to speak more to that. I don't think you have to be pre-med student.
Yeah, you just have to be pre-health, interested in some healthcare aspect and taking some science courses, because a lot of the students that you're going to mentor are in a health academy or they're some type of health pathway. And so they usually will ask you questions, how are your science classes, or, how difficult is college as it is in high school and so forth. So that's why we ask for at least being a second year, because at least you've gone through 1 year at UCR and kind of gained some knowledge and experience and you can share to others. Thank you. Thank you for being here. Any other questions? Don't be shy. And you're also welcome to put it in the chat. So if you're kind of exploring what is it that you want to do, I do recommend doing FPL. It's a good way to learn from others. That's why I do the lecture series. It ends up being very diverse and not just MDs, because I really want you to kind of get an idea and a feel for different healthcare industries and what you could possibly, major in or become, or, after graduation, what you want to actually go into, what industry and what field. So definitely, if you're just like exploring, try FPL.
I know sometimes I get asked around how do I prepare for the MMI interview for health coaching. So I know HPAC is a great resource and they have some great workshops and then opportunities for you to practice that MMI format. But you're also more than welcome to reach out to me directly. I'm happy to run through like a quick one-on-one meeting where we can practice that. And if you're going to practice on your own, I always tell individuals, if you can, try for a MMI type question. So I know, I think AMCAS and There's a bunch of blogs too online for pre-med students where you can sometimes find those. But in general, I think what's more important is not so much like practicing the questions, but more so practicing the review of just looking at a question for 2 minutes on your own, taking quick bullet point notes as to how you want to address this, answering this question, and then practicing communicating the answer to that question in a 6-minute time frame, because you only get 8 minutes per interviewer, so 2 minutes to review each question and then 6 minutes to answer the question with the live interviewer. So I know for a lot of people the time constraint could be nerve-wracking, but if you just practice, it gets better the more you practice over time.
So if you want, we can stop the recording now, just in case anyone's shy and they don't want to be on camera. And then we'll, Charlie will post it on the YouTube channel. But if anybody has any questions,